Okay, yes, dear Mr. President and dear audience, I'm very pleased that you invited me to your marvelous congress in that very nice city. And as you just heard, nothing is evidence-based, only the compression. All other things, what you can use in lymphatic therapy, is not really evidence-based. It's only based on experience, and we have to try a lot of research. But it's very difficult in Germany, for example, when you have your patients as inpatients in a clinic, and it's paid by the insurance. You cannot tell, okay, you get the manual drainage, you don't get it, you get flow wave, you get Hivamat. So it's not possible for now to get a very severe evidence for that, but now we try with indocyanine green, with fluorescence technique, to show if there are better results or no, and we recognized some parts, for example, that in some cases the manual drainage has to be more severe, more harder than in other cases. So I think there will be a lot of changes in the next few years. But we have some instruments for the therapy in addition to the normal therapy, what you heard. So the edema, extracellular edema, is an excess of interstitial fluid and is an important sign of health in clinical medicine. The elevation and diuretics reduce the venous pressure and consequently the capillary filtration rate, but they do not improve the lymph drainage. This is one of the points. All edema is due to an imbalance between capillary filtration rate and the lymph drainage. We call it dynamic, mechanic, or safety function insufficiency. The reason for lymphedema is a mechanical insufficiency, so that means we have a failure of the lymphatic vessels or of the lymph nodes. And this may be primary, or it may be secondary. Secondary, we make a difference between benign and malignant. Primary lymphedema, just some pictures. And that depends on the age when it starts. Is it from birth direct to the, up to the second year? Then we call it, it's from birth. And then we have a follow-up to the age of 35 years. That's lymphedema precox. And there's later years, it's an lymphedema tardum. So you just some patients with primary lymphedema. On secondary lymphedema, the reasons benign or malignant, maybe you have the primary tumor or metastasis or recidives, and benignant due to infection. Worldwide we have the most infection with filariasis, about 130 million patients we have worldwide. Then traumatic reasons, artificial, and that's growing in Germany, is the artificial edema, because the patients do themselves a strangulation on the limb to get retired. And the more the economy is going down, I think the more those cases will start and grow. Then tumor and due to medical reasons. For example, just the case of filariasis, case of uterus cancer, prostate cancer, patient with secondary arm lymphedema, face lymphedema. This is a case of starting with primary lymphedema, and then she got a very severe mosquito bite, and then she developed that severe lymphedema. So it's it started as a primary lymphedema, and now after a lot of cellulitis, so then she developed that case, and she was lying in hospital for 1.5 years without any treatment, just taking care of her. The management of lymphedema, and you heard before, and thank you to Professor Feldi and her husband. They told all over the world the treatment of the lymphedema, and they started with education, and this is the reason why we know a lot of lymphedema and about the treatment. So the main start in the phase of reduction is manual lymph drainage, and Professor Feldi told you you have to do it all days. Then skincare, bandaging, and gymnastic, and the difference in the maintenance phase, you have the manual lymph drainage. That depends on the possibility for the patient, maybe 1 or twice a week, or just some series of manual drainage and nothing else, skincare, medical stockings, and gymnastic. So, and now, years after years, we recognize that the patients in Germany, and we are the best in overweight in Europe. And this is the reason why we have to implement the nutrition in our treatment, because we have a lot of obesity patients, and this is the reason why we have to take the nutrition in our regime and the motivation. And as long as everything is covered by the insurance, there's a reimbursement for the whole treatment for the patient in Germany, so they are not really motivated to go on with the therapy, because then next year they get another week, 3 weeks in a clinic or so on. So they are not so motivated than our patients from abroad, because they have to pay everything by themselves, and this is the reason why they have more motivation. So in manual lymph drainage, we use daily on Saturday and Sunday too. Then the manual drainage is added with lymphopress, infrared cabin, soft laser, pulsed magnetic field. On patients with ulcerations, we add ozone gas. It takes 1 week with ozone gas around the limb, so then there is no infection on the ulcer again. So even MRSA is killed with ozone gas. And then we use sometimes CO2 gas for patients with arterial disease or when you don't have a healing of the ulcer. Then Hivamat, it's an electrostatical field and flow wave. Bandaging, we have short stretched, ultra short stretched, long stretched, taping, and when the patient leaves the clinic, so then we provide them with a medical garment. Gymnastic, we use physiotherapy, relaxing exercising, qigong, therapeutical dancing, and the lympho-op walking. Nutrition, metabolic food, reducing weight, healthy food, buffet, and menu card. Motivation is very important to educate the patient in motivation. And we can give them the motivation when we tell them how much fat he reduced. So that's the reason why we always do the bioimpedance analysis to show the patient the fat, the water, and the muscle. And we do the parameter measurement, that means an optoelectronic measurement of the limb to show them the reduction of the circumference and the volume. So when he sees that there is a good result, so maybe his motivation will grow. Then psychotherapy, health education, and lymph network. And so in Germany we have about now 60 different lymph networks, so that the patient can be sent to a network and then he gets the same treatment. Because the education of doctors still is very low in lymphedema. Manual lymphodrainage with lymphopress. We always use the trousers. That's pneumopressor therapy, so it starts at the toes and it finishes in the belly area. There were some papers that wrote that you have genital lymphedema when you use those pumps. The patient will develop genital lymphedema when you use only sleeves. So then you push the liquid high to the groin, but not more. And this is the reason why we always use the trousers. On patients with arm lymphedema, we use always a jacket so that there is not a stop in the axilla area. Then, as I told you that we have a lot of bariatric patients, we have bariatric pants. So we can put in patients up to 200 kilogram in the pneumopressor therapy with very good results. They feel very well, but it's not evidence-based. It's just for experience. We have the experience for bariatric patients in combination with all those therapies that we receive good results with that. Infrared cabin, special for patients with lipedema, because in the infrared cabin we open and get a better microcirculation in the fatty tissue. Soft laser we use on ulcer, and we use special on patients with scars, so it softens the scar and it takes the pain. And you know, you have those devices in Italy, so that's not a German product, that's an Italian product. So we learned it from Italy and now we took it in our clinic. Then pulsed magnetic field. We did some measurements and we recognized when you have a pulsed magnetic field that there is some influence of the vessels. Maybe that's a contraction of the muscle of the lymphatic vessels is better, because when the patient has to lay down on the magnetic field, one day we open it, the other day it's closed. So the patient doesn't know, is it a day when it's open or when it's closed? And we recognized that there's a better outflow of about 20% when you use magnetic field, but it's not evidence-based. So ozone gas, CO2 gas, and Hivamat, that's a treatment in an electrostatical field. It's like you have an acryl shirt on it and you put it off, so then you recognize there are some electricity in it. And we use it and the same on the patient. So the therapist has a plus electrode, the patient has a minus electrode, and then we use latex gloves. And when you go on the skin and slip on the skin, you receive a rubbing. And this is special for patients with chronic disease and lymphatic disorders. The flow wave, I don't have to explain the flow wave. It's a development from Italy. There are some research that showed after 10 days of treatments, you see better lymphoscintigraphy than before. Hearable sound waves, we use it on patients with face edema too. This is a patient with nose cancer, so you see the orthostasis. Then on chronic ulcers, just in 10 days, it's closed. Then we use a transponder, special on patients for home treatment. They can use this device by themselves. It softens this tissue, and so the edema becomes softer. What is it? Microcurrent portable device for the treatment of lymphedema, home care, especially in phlebologic and lymphatic disease. On operations, we do a shaving operation, resection of papillomatosis, liposuction, and lipocavitation. This is a shaving, direct 5 days after, and then 1 year after. Then papillomatosis, cutis lymphostatica, so there's a resection after compression. So then you can go on with resection of those papillomatosis without any bleeding or lymph fistula. And liposuction and lipocavitation. Liposuction in some cases, in arm lymphedema, we do it like Hakan-Brausen, but there are only a few patients, because most of the women, they want to get rid of the garment. But after liposuction, they have to wear the garment all days without any exception. So what use of the liposuction in those areas? I think it's better to go on with transplantation or lymphatic, like Campesi does, lymphovenous anastomosis. There are better results, but in those cases, it's just for cosmetic, nothing for the healing or better outflow of the lymphatics. The lipocavitation does the same, destroying of fat cell by high-intensity focused ultrasound. No anesthesiology, no destroying of other tissues, but it's a long-term acting, and it takes a long time till you see a few results, but only on patients with non-pitting edema. The pitting we can reduce by all our other therapies, but not with that. Okay, so this is the device, and the big leg tells, with those shoes, I look like nice as you, but then the nice leg says, yes, sure, but first you have to go to the lympho-op clinic. Thank you very much for your attention.